Number 6, the promise of brain biomarkers. There is now a global initiative using a variety of fingerprints, scientists call them biomarkers, that have been developed to help identify their role in the inception, development, and ongoing cascade of damage caused by psychiatric and neurodegenerative diseases. Granted, the search has been painstakingly slow, especially when compared to the great successes that have already been achieved in the past 2 decades by heart and cancer researchers using their own particular sets of biomarkers. Although neuroscientists still have a long way to go, the hunt is on, which is the good news. Major psychiatric disorders such as schizophrenia, major depressive and bipolar disorders are severe, chronic, and debilitating, and are associated with high disease burden and healthcare costs. The problem is that making a diagnosis rests primarily on a patient's subjective answers to a doctor's queries and the subjective interpretation of them by the physician. Because of this, early diagnosis of many psychiatric disorders is often difficult and misdiagnosis is frequent. Moreover, there are no objective tests that can help predict an individual response to medical therapy. Understanding this unmet need, scientists are working to develop a variety of lab tests for mental illnesses and neurodegenerative disease by identifying biomarkers in blood and spinal fluid proteins, but also in brain imaging patterns. When it comes to a neurodegenerative disease such as Alzheimer's, which currently affects more than 5.4 million Americans, researchers are trying to develop biomarkers from blood, urine, spinal fluid, mouth scrapings, and by neuroimaging with MRI and PET scans. There are now experimental blood tests for Alzheimer's disease that appear to detect the disease years before the onset of symptoms. While both of these blood tests need further validating studies, the hope is that one day they will be as ubiquitous and as effective as current lipid markers for heart disease.
So we have Nazem Atassi here, who's an expert in biomarkers and imaging, and I'll ask you a very straightforward question. How do you envisage novel brain biomarkers impacting treatment and prevention protocols and treatment of disease?
I think brain biomarkers are going to be essential for drug development in the next 5 to 10 years, especially in neurology. I want to highlight 2 main different types of biomarkers. One of them is a diagnostic biomarker for diagnosing early disease, and the other one is a readout biomarker for drug efficacy. For the diagnostic biomarker, I want to give an example from the Alzheimer's disease, is that we know from Alzheimer's that both CSF biomarkers and imaging biomarkers appear years before patients develop their symptoms. We also learned recently from clinical trials and clinical development that you want to intervene early in the disease in order to get a symptomatic relief from patients. So the marriage between having a biomarker that identified the disease early and the need really made these type of trials feasible, and it looks like it might be successful.
And will imaging play a role in discovering new brain biomarkers and vice versa? Absolutely.
I think brain imaging is a great way to look into the brain. The brain hides behind the skull and the blood-brain barrier. And it's really imaging is our window to kind of look into the brain. So with MRI, you could look at very high resolution images of gray matter and white matter and tracts. And with PET imaging, you could look at molecular images of proteins and receptors. You could look at multiple sclerosis as an example where brain imaging led to successful discoveries.
Thank you.